Hello everyone! Today we are going to talk about 3D printing nose surgery. Plastic surgery restores unique human qualities such as appearance, speech, hands to improve interaction with others and quality of life. Three-dimensional printing has increasing medical application in education and planning, but its specific role in surgery has remained challenging to define. In this video, we will tell you in details about 3D printing nose surgery, what it is, the reason of resorting to it, and the expected result after the operation. Our role today is to answer most of your questions regarding 3D nose surgery. Today we have Dr. Kim, who is a leading doctor at Lara Plastic Surgery. He's going to discuss with us everything about 3D printing nose surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim, how are you?
Hello, my name is Jung-Do Kim, the Representative Director of Lara Plastic Surgery.
Okay, so we will start for our first question. Why is it 3D CT scan is important for a nose surgery?
It would be good to fully understand the structure of the nose for surgery, right? When you have a CT scan, the CT scans the bones first, because it helps to understand the condition, curvature, and various aspects of cartilage as well as the bones. It can be seen that CT scan first, and then nose surgery is much more helpful for the result of surgery.
So can you explain what is actually a 3D printing rhinoplasty is?
3D printing rhinoplasty does not print nose implants with 3D printing, but rather prints the nose bones with 3D printing. Usually when we do rhinoplasty, if we just do the surgery without such preparation, we make an incision, open the nose, and immediately carve the implant and perform the operation. In this way, the wound and nose incision are exposed for a very long time, so the recovery period is long, and there is a high possibility of inflammation or side effects. Also, if the nasal bone does not fit snugly with the nose implant, there may be side effects. So 3D printing is a method that was created after concerns about it.
So, Dr. Kim, I've heard that you are the one who made the 3D printing rhinoplasty, so can you explain more about it?
The concept of 3D printing rhinoplasty that I introduced is not to print the implant through 3D printing, but to print the nose bone and apply it immediately. The nose implant is pre-cut by looking at the bone, because the reason for doing this is that it would be much better if the implant was printed with 3D printing, but it could be dropped during surgery, and the patient may not like the implant. Especially in the case of foreign patients. They want to have surgery on the same day, but it may take several days to make the implant, so the timing may not be right. So there are various types of ready-made implants that print bones and fit the implants there. So it came up with the concept of fitting them.
So can you explain some of the benefits of this procedure?
As I said, we print the nose bones, and there are many advantages that we can get from printing the nose bones. First of all, in the case of revision surgery, there are cases where the implant is inserted into the nose bone. Then you wouldn't know what your nose looks like. Some patients come here because of wrong revision surgery, so it helps a lot when consulting with the bone print. After that, it would also be very helpful for surgery with the printed bone, because you can do the carving in advance. And if you decide to what level you want to go, it could be said to be an innovative method for nose surgery, because the implant fits perfectly with the foundation and there are very few phenomena, such as lifting or turning.
So some people doesn't like implants in their noses, so in these cases, is 3D printing techniques still can be used on their rhinoplasty?
Yes, a lot of people who don't like to put implants in usually have a big nose. People with big noses come for surgery to reduce the nasal bone, reduce the tip of the nose, make it natural, or improve the hook. Even in this case, if no surgery is performed with 3D printing, how to reduce the nasal bone and how to shave the ribs are planned in advance. So of course, it could be a big advantage in rhinoplasty that does not use implants.
In this case, is it possible to do a nose tip surgery without implant as well?
Usually in the past, implants were inserted all the way to the end, or there were many surgeries like this. But recently, the nose tip is operated using autologous tissue, or, for example, nasal septum cartilage, autologous costal cartilage, or ear cartilage without inserting an implant. I'm not sure about the tip of the nose in the past, but now, especially for me, implant-free surgery is the rule. Usually in the old days, there were many cases of surgery by inserting the L-shaped implant or a long implant up to the tip of the nose. In such case, there were many problems such as the implant protruding through, showing through, or turning because the foundation was not sturdy. So recently, the tip of the nose is usually operated softly and naturally using autologous tissue, such as autologous costal cartilage, ear cartilage, and nasal septum cartilage.
So, Dr. Kim, is silicone implants are necessary for nose bridge surgery?
Silicone implants are often used for nose bridge surgery, but in fact, Gore-Tex and other materials can be used according to the doctor's preference. In fact, when inserting an implant into the nose bridge, of course, it is only used for people with a low nose, but it is not necessarily for people with a high nose. In particular, in the case of a large hook, if the nose is shortened by cutting the hook and cutting the bone, implants are never used. However, when this silicone implant is needed, it is the most widely used form of implant, so it is not so dangerous or unstable, or to the extent that there is a problem with surgery. It is safe.
So some people prefer nose fillers, but as a doctor, do you recommend that to your patients?
Since fillers are easy and have immediate effects, I don't think it's bad if you need them. However, since this filler is a gel type, its shape changes, even if the shape you put in at first looks pretty. There are cases where the nose part becomes a little thicker because it spreads out or lowers, so I think it would be okay to receive the treatment as long as you consider these points. I usually feel that it is a simulation before surgery, so I don't think it's bad to do it once.
So, Dr. Kim, are there any structural difference between the Western and Asian noses?
It's hard to tell the difference between Asians and Westerners. Most Westerners have larger noses and larger nose bones, and Asians tend to have lower noses and round nose tips. In fact, this is why the surgical method differs. But in the case of Westerners, there are many reduction surgeries. The nasal bones and hooks have to be shaved off a bit, and the nasal bones that are open outside have to be narrowed down a bit. Also called wing cartilage, the cartilage of the nostrils is often very long. In such a case, there are many cases in which we carefully handle it and make it beautiful. That's how Western nose surgery is done. In the case of Asians, we have to make it a little bigger and make it taller. For that reason, there are many cases of using implants. And when raising the wing cartilage at the tip of the nose, cartilage such as nasal septum or autologous ribs are used to erect a pillar to make it higher. Also, since there is a lot of fat on the tip of the nose, it is often necessary to remove a little bit of the fat between the cartilage and the skin. In addition, when looking at the side profile, Westerners often have a slightly convex shape, while Asians often have a flat face. So it seems that there are cases where fat grafting or fillers are used on the tip of the chin, on the foot, on the forehead, or on the cheekbone to make it a little prettier. So in general, the structure and nose shape are different from those of Westerners and of Asians, and the profile is different, so it seems appropriate that the surgical method is slightly different also.
So is it possible to correct a large nose tip with nose wing reduction or any procedure that you recommend?
A nostril reduction is a surgery to reduce the outer wing here, not the tip of the nose. In fact, if you just reduce it, it will be immediately improved if the tip of the nose is narrow. However, if the tip of the nose and the wing cartilage part are large, this part must also be improved to make the nose beautiful, right? If there's a lot of fat between the skin and cartilage, you may have to remove the fat. That is, you can remove the tissue inside by going into the plane separately from the top of the skin and the top of the cartilage. If the nose tip is large and the wing cartilage is large, even after removing that, the big principle of nose tip surgery is to design it in an ideal shape and remove a little cartilage.
What if a patient has difficulties of breathing? So can it be improved by having rhinoplasty?
Of course it's possible. The nose tip and nose bridge surgery is actually a surgery to operate on the outside of the nose structure. And when you breathe, the operation is performed on the inside of the nostrils, not the outside of the nose. The most problematic part is when the septum is bent. In the case of removing the cartilage of the septum for surgery on the tip of the nose, it is naturally removed with a little more care, but the curved part of the septum is improved naturally. The non-valve part will also be improved if more cartilage is removed to straighten the curved nose. Of course, you have to look pretty from the outside, so holding the inside straight is a natural surgical method. The way the foundation is straightened to some extent, making it easier to breathe. In particular, our hospital can perform surgery to reduce the mucous membrane, using special equipment for that part that appears like a lump in the inner structure of the nose, called the inferior turbinate. So the curved ones are fixed overall. The narrow ones become wider, and the thicker ones become thinner, so the nose path itself becomes wider. This will make it easier for you to breathe. However, we don't do it when the trouble part of breathing is a problem with the nostrils. If there's another part, you need to treat the other part.
So what are the possible side effects after having rhinoplasty?
Of course, side effects of rhinoplasty can include scars at the incision site, followed by inflammation. When the pillar is erected with a nasal septum or a self-rib, if the tension of the pillar does not match well, the tip of the nose may become twisted. When the cartilage is removed further, cartilage can be seen through if the skin is thin. Then, after the cartilage of the septum is removed, there is a space there. If you do not press it well, a hematoma may form in the septum. In addition, since the implant is inserted, if the implant becomes inflamed, contracture may occur later. However, according to each problem, our hospital has sufficient preventive measures and is preparing, so I think it is safe to say that there will be no problems.
So how long does it take to return to normal life?
Usually, if you need to do paperwork, the packing in your nose will be pulled out the next day. In that case, it seems that there is almost no problem in daily life. However, in the case of osteotomy, the swelling lasts a little longer, so it is better to take a week off. You will also be given a splint after rhinoplasty. These days, it's not noticeable because we wear masks, but you won't be able to do activities that cause problems when you walk around with a splint. And in the case of exercise or strenuous activity, it is recommended to be careful for about a month.
So come to our last question, what should patient look for when they choose a hospital for this procedure?
The nose is a very important structure because the structure is in the middle of our body and is where we breathe. Therefore, I think it is important to have the surgery done by an experienced medical staff who has sufficient knowledge of anatomy, about the nose, and has a plan exactly what to do if rhinoplasty is performed. In addition, I think that receiving surgery from medical staff who can faithfully and carefully answer the questions our patients bring is a safe way to receive surgery when coming from afar. Please ask enough questions before undergoing surgery. Thank you.
네, 감사합니다. Today we learned many things about 3D printing nose surgery, and the doctor explained in details everything related to this surgery. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.